Hello, everyone. Welcome to our webinar today. This webinar is a presentation of Clean Energy Group, and the topic for today's webinar is Energy Resilience for Medically Vulnerable Multifamily Affordable Housing Residents, a Techno-Economic Analysis for Connecticut. And we have an excellent panel of guest speakers with us today, but before I hand it over to them, I'd like to go over a couple of webinar logistics. We are now using Zoom webinars. This is a new platform for us, so if you have any feedback, we encourage you to submit that in the post-webinar survey or via email. All attendees are in listen-only mode, so your webcam and microphone are disabled. The chat function is also disabled. The raise hand function is also disabled. So if you would like to submit questions and comments, we streamline all of that through the Q&A panel. You have a Q&A button on your screen. Just submit them through there, and we'll save 20 to 25 minutes at the end of the presentation for speakers to answer these questions. So we encourage you to submit them throughout the webinar. And also automated captions are available. The speakers' bios will be put in the chat as they're being introduced in the beginning. And finally, this webinar is being recorded. We will email you a webinar recording within 48 hours, and it will also be posted on Clean Energy Group's website at cleanegroup.org/webinars. And with that, I'd like to pass it over to our host for today, my colleague, Anna Adamsson.
Awesome. Thank you so much, Zareen, and thank you all for joining today's webinar. This webinar is a presentation of the nonprofit Clean Energy Group. We are a nationwide organization that works to advance affordable, reliable, clean energy for all. I would encourage everyone to go to our website, cleanegroup.org. You can see it at the bottom of the screen here, to learn more about our programs that we're working on and the initiatives that we support. Next slide, please. This webinar's topic is at the intersection of health and energy security, and specifically how solar and battery storage paired together can keep life-saving services powered for medically vulnerable residents at multifamily affordable housing providers. Again, like I said on the last slide, I would encourage folks to go to our website and go under the Health and Energy Security tab to see examples of other initiatives that we're supporting, for example, with health centers and cooling centers. Next tab, please. I want to take a second to highlight the Technical Assistance Fund program that we house at Clean Energy Group. This is where we provide one-on-one technical support, pre-development support to community-serving institutions interested in how solar and battery storage can provide resilient backup power. Folks like multifamily affordable housing providers, health centers, community centers, resilience hubs, houses of worship, the list goes on, can apply for this program by going to our website, and again, will receive one-on-one support through Clean Energy Group and ultimately receive a techno-economic feasibility assessment. That looks to some degree like the case studies that you all will be hearing about more in today's webinar. So again, go to our website to learn more about the Technical Assistance Fund and see if your organization, if your facility is interested in receiving that pre-development support. Next slide, please. I would like to introduce you all to today's webinar speakers. First, we have my colleague Marriele Mango, who is a Senior Project Director here at Clean Energy Group. Next, we have Bryan Garcia, who is President and CEO of Connecticut Green Bank. Joining Bryan, we have Edward Kranich, who is a Senior Manager at Connecticut Green Bank. Next, we have Annie Harper, who is an Assistant Professor of the Yale School of Medicine, Department of Psychiatry. We also have Keyla Palala, People and Operations Manager at Operation Fuel, Nate Mills, Vice President of Operations at American Microgrid Solutions, and lastly, Emily Basham, who is Associate Director at Connecticut Green Bank. And again, I will be moderating today's webinar, so you all will see me at the end. As a reminder, you all can submit questions for today's webinar throughout everyone's presentations. I will be looking at them throughout and picking them out at the end. We'll reserve time at the end to answer them live. So please do not hesitate to put in your questions as you think of them throughout today's presentation. So without further ado, I will pass the mic over to my colleague Marriele to begin the webinar.
Like my background, there we go. Hi everyone, I'm Marriele Mango, I'm Senior Project Director at Clean Energy Group. I just wanted to kick things off by letting everyone know that this webinar is based on a report that the group of people featured here today all contributed to. It was published in February. You can find it on Clean Energy Group's website. It's called Optimizing Energy Resilience. And it really goes through the entire process that we're featuring here today in a little bit more depth, including the analysis results. And really at the heart of this effort was working as a team to understand what are the unique health vulnerabilities of multifamily affordable housing residents, and how can we work with providers to develop solar and storage and energy resilience solutions that support folks as best as possible in the event of an outage and can contribute to improved health outcomes in the event of an outage. So that's kind of the underlining mission here, and we'll dive into the results of this. And if you'd like to learn more, please check it out. Next slide, please. So with that, I will pass it to the Connecticut Green Bank team.
All right. Good afternoon. Good morning. Thank you, Marriele, for that context setting. We're great. It's exciting to be here with everybody today. Just a few background comments on the project. We obviously had a great team, which we will talk about, and folks will be presenting on. But just wanted to note that this project was co-funded by two organizations, the Robert Wood Johnson Foundation, who took a very active role in supporting the various states underneath the National Association of Insurance Commissioners. And Connecticut was fortunate enough to be one of those states. And this project, as we'll see, is an important part of that effort. And then secondly, the Connecticut Green Bank as the co-administrator of the Energy Storage Solutions Program here in Connecticut. And Ed Kranich is going to provide an overview of that program. Let's go to the next slide. Just a quick project overview. So when we talk about climate smart technologies, we're talking about a couple of things. We're talking about backup power. So you could think of solar PV, battery storage, solar plus storage. In Connecticut, we're talking about the Residential Renewable Energy Solutions Program, the Energy Storage Solutions Program. So you might hear RRES, ESS, those are our acronyms. But we're focusing on climate smart technologies from a backup power perspective, as well as stable indoor temperature perspectives. So our partners at the Conservation and Load Management Fund are two utilities, and the Department of Energy and Environmental Protection, ensuring that we've got efficient heating and cooling and weatherization of properties, specifically multifamily affordable housing properties. And we want to make sure that we're enabling the deployment of those technologies so that we could increase the resilience of tenants who have home medical device needs for their health. We have a number of great partners for this project. The Insurance Department, as I noted, the NAIC, the National Association of Insurance Commissioners, and the state of Connecticut with support of the Robert Wood Johnson Foundation, the Green Bank, the Yale Center on Climate Change and Health, the Clean Energy Group, as well as American Microgrid Systems, Nate and team, and Operation Fuel. Let's go to the next slide. Our key project had three components to it. We're going to hear all of those aspects today. Community engagement. We're going to hear from Keyla and Annie from Operation Fuel in Yale, which really dug into social science research and helping us understand how tenants residing with home medical device needs can become more resilient in their minds, what they believe is needed. We're then going to dig into the technical assistance aspects by the Clean Energy Group and AMS, specifically looking at solar plus storage, as well as energy efficiency within various affordable housing projects that they supported. And then lastly, financial assistance. If we can work through all of that, how can we put together the financing to enable all of that to happen? And we've got Emily Basham, the Associate Director here at the Connecticut Green Bank, who's going to provide an overview of our solar MAP program, specifically for multifamily affordable housing. So with that, let me turn it over to Ed Kranich, who is going to provide an overview of the Energy Storage Solutions Program.
Thanks, Brian. Can you hear me okay? Sounds like it. Okay. Thank you. All right. So I'm Ed Kranich. I'm a Senior Manager of Incentives with the Connecticut Green Bank, and I manage the Energy Storage Solutions Program. The Energy Storage Solutions Program is managed by the Connecticut Green Bank, Eversource, and UI together. and it's a program overseen by PURA, the Connecticut Public Utilities Regulatory Authority. So next slide, please. So the program itself, I'll admit, is quite complicated. So I'm going to try to distill it in about 5 to 7 minutes. So happy to answer questions towards the end, or meet one-on-one with anyone who wants to talk more about the program later on. We have our contact info at the end here. So why energy storage in Connecticut? Where did this all come from? So there are 2 services that batteries can provide to folks. The first one, the obvious one, is backup power to individual customers. So think to tenants, residents of a housing facility, and to the owners of a housing facility. It provides resilience in the event of a backup or in the event of an outage. When those batteries aren't doing any backup activities, however, they can do something that generators can't do, which is they can contribute to reducing energy costs for all ratepayers. And the great part about Energy Storage Solutions, the incentive program, is that it pays battery owners for providing those services. So that's the top part of the chart here, is it helps to smooth out peak demand on the grid. And then in times of an outage, it can provide on-site backup power when needed. The other thing that batteries can also do, and it's kind of it depends on the site for multifamily properties, is that they can also provide demand reduction services. So batteries can actually provide they can provide monetary savings for customers that have a demand charge or that have a big differential in their on-peak and off-peak rates. I left this out because residential rates for multifamily, sometimes they're straight residential rates, other times they might be commercial. Multifamily housing is very complicated in terms of metering. So it's one of those things where it's very site specific. So I don't like to get into too many specific details talking about multifamily. So next slide, please. So just some regulatory background and kind of the history of how we got here. So back in the program actually started out of PURA's Equitable Modern Grid framework, which began in, I believe, 2019. And it was an investigation by PURA into making the grid, more equitable and modern by improving resiliency and decreasing energy costs, decreasing emissions, and doing it for everyone. That's the equitable part of it. So in Public Act 2153, the state established a statewide goal of 1,000 megawatts of battery storage by 2030. And the Energy Storage Solutions Program was authorized as part of that and launched in 2022 with a goal of 580 megawatts specifically of behind the meter storage for residential and non-residential customers. So it's a 9-year program. So it started in 2022. So we have until the end of 2030. And the program has specifically a goal of 40% of the benefits reaching underserved customers, which is primarily going to be through distressed municipalities in Connecticut or low-income customers. And when reaching low-income customers, the way that we intend to do that, probably the most straightforward way to do that is through multifamily affordable housing. The nice part about the way that the program has been written is that low income or the multifamily affordable housing can access the low income residential rates, which are significantly higher than standard residential or commercial rates. And commercial incentive rates are what apply to traditional market rate housing. So just highlighted on the screen here, we have where we currently are in our current incentive tranche. So on the residential side, things have been going pretty slowly in terms of, single family residential. So we expect multifamily to kind of pick up, to help pick up the pace on that, especially with regards to serving underserved customers. So next slide, please. So here I just have a comparison of market rate multifamily versus affordable multifamily. So market rate multifamily can access the commercial incentives, which can be anywhere from $91 to $182 per kilowatt hour in an upfront incentive. Whereas for affordable multifamily, it can be $600 to $900 for certain customers, which are considered grid edge. So those customers who experience more frequent or longer duration power outages on average. What this means is that the upfront incentive can cover up to 50% of the total installed project cost for a multifamily project and for an affordable multifamily project. And in many cases, it gets there pretty quickly. There are additional performance incentives over a 10-year period, which are not capped. And then, of course, there's tax credits available as well. So these incentives can very quickly add up, which I intentionally did not show how it would pencil out for a specific project because projects are very site specific, but we always encourage developers and site owners to come to us, bring us your information, and we can help kind of work something out to give you a better estimate for your site. Exchange for the upfront incentive and performance incentive is that by agreeing to accept the upfront incentive and performance incentive, the site owner would agree to have their battery programmed to discharge its energy to the grid during peak times when called by the utility. So during the summer and a couple of times during the winter, the battery would discharge its energy during the hottest days of the summer and during some of the coldest days of the winter. However, we don't call events anytime that there's an expected outage or a major weather event coming. We also allow consumers to use any built-in weather protection services that are offered by their battery manufacturers as well. So resilience is very important to us, and we want to make sure that customers still have that no matter what, but that they also provide benefits to the grid by sending power off from their battery to the grid at peak times. So next slide, please. I just have some info here. So more information. Again, as I said, the program is a little bit complicated in how everything works and how the dispatching works. So happy to speak more about it. EnergyStorageCT.com. You can learn more about the program. We have pretty frequent webinars and contractors can apply and you can learn more about the program or even speak with our team, set up a one-on-one meeting or training. So with that, I will turn it back and happy to answer any questions towards the end.
All right, great. I'll pass it off to the Operation Fuel and Yale teams to talk about resident engagement.
Hi, everyone. My name is Keyla Palala. My colleagues and I, along with the Yale team, were tasked with the community engagement piece of this project. Data was collected through 33 interviews, 9 focus groups and surveys, with 78 home medical device users, including those who use or care for someone relying on electricity-powered medical devices in affordable housing specifically. We also spoke with healthcare workers and housing staff to get different perspectives. We asked them questions about their experiences, and to the right, next slide, please. To the right there, I added a map that highlights the towns and cities in Connecticut that were included in this focus group. We wanted to ensure a diverse range of locations in our outreach efforts, and some of these towns include Hartford, New Haven, Manchester, West Haven, Vernon, Portland, Danbury, and New Haven. The findings highlight how much people depend on electricity, how they prepare for outages, and the emotional impact of losing power. We also explored some possible solutions, including backup power and better communication and affordable housing. These insights really helped improve support and resilience for medically vulnerable communities. To analyze the information that we gathered, we grouped responses into key themes and looked for patterns. And so with that, I'll hand it over to Annie to share some of the recommendations for next steps.
Thank you. Hi, everyone. It's great to be here. I was introduced Annie Harper from the Yale Department of Psychiatry. And I just want to say before I jump into this, how much I appreciate that the component that Operation Fuel and Yale led was included. It's not typical to invest in hearing from people who are most impacted, especially if they're marginalized communities. So I really appreciate it, and I think it's made the project more successful. So as Keyla said, and I also wanted to give credit to the Yale School of Public Health's Center on Climate Change and Health, and specifically the clinic class that I was teaching at the time. So there were students from that class were played an instrumental role in doing the research along with Operation Fuel. So Kayla's outlined some of the key findings, and building on those findings, we have some recommendations for next steps. So one of the things that came across really powerfully was the extent to which people are dependent on electricity for their health and, frankly, their survival. We started the project, our interviews, with kind of a list of home medical devices. But as we talked to people, it really became clear that they rely on more than we had thought. So our recommendation is really to think about what a home medical device is in a broader way. People talked about air conditioning, cell phones, elevators, medical alert devices. So again, really just trying not to limit the definition of what a home medical device is. We also heard that we spoke to people in a number of different buildings, as Keyla pointed out, and in buildings where there was a good relationship and good communication between management of the building and the residents. People were, for example, enrolled in utility alerts, they understood kind of what protections they had, specifically medical protections. So when people had those alerts, when they had medical protection, they felt reassured that they were getting the support they needed. So just making sure that people know what's out there for them. We didn't go into this, the primary goal was to talk primarily to users of home medical devices, and then a few healthcare providers. That was kind of came in a little bit later. One of the things we learned is that particularly home health aides and nurses, medical or health providers who are actually regularly in people's homes and who tend to be the person they call if they have a challenge, those people have huge insight both into the challenges that people face and kind of potential for supporting people in case of a crisis. So we recommended that in the future, just connecting with that incredibly important sector of the healthcare provider network. We also heard from a significant number of people that when they had they experienced a power outage in the past, or if they thought about if they would experience one, how often people went to the emergency room. So we heard stories from people who went to the emergency room literally just to be in a bed and be connected to whatever device they needed. So they certainly weren't sick. They just needed to have electricity, and just thinking of the cost of somebody taking them down the stairs, the ambulance taking them to the hospital. So really thinking about how, as we provide people with backup power, we can actually reduce financial strain on our emergency services. And you can imagine it during a power outage, things may be happening which will increase the need for emergency services. So just making sure that we understand the implications there. Again, buildings, it differed from place to place, but some housing providers had really comprehensive plans and had communicated what their emergency response plans were to the residents. So obviously we thought if one building can do it, everyone can do it. So really just making sure that housing providers know what's possible and to give them support in providing those plans. Safe common spaces are, I think, the obvious solution. We did hear from people that not everyone feels comfortable using a public space like that, but it does seem to be the kind of the most realistic option for people in case they lose power in their apartments. And they did talk about the things that would be helpful to have there, definitely somewhere to charge phones, refrigerator, etc. Given that we found quite a lot of discrepancy between the different housing providers that we spoke to, the different buildings, we feel like there's some real opportunity for peer-to-peer learning here. Because again, some have really been able to do what they need to do, and others not so much. And then obviously making sure that the housing providers know what's available in terms of financing to put things into practice, and connecting with the Green Bank and other providers to make sure that they're engaging these public-private partnerships that will enable them to have affordable housing that's also resilient in case of power outages. Thank you.
Great, thank you so much. So with that in mind, I'm going to go through just a little bit of upfront overview of how we designed the technical assistance process, taking into consideration both the robust programs for solar and battery storage that Connecticut has and were overviewed earlier, as well as the findings from Operation Fuel and Yale's resident engagement piece, which Annie just went over really well, and really trying to focus on how can we create a technical assistance process that provides realistic solar and battery storage results for multiple types of scenarios, depending on the multifamily affordable housing provider, and also takes into consideration the unique health needs of that particular facility and their residents. Next slide, please. So before I jump into the actual solar and battery storage piece, I wanted to note that this effort did include some additional energy support. And that was primarily in making sure that every facility had their FEMA risk score, as well as an Energy Star score of what their existing energy score rating is. So American Microgrid Solutions, who will be chatting after me, provided each facility with their Federal Emergency Management Agency FEMA risk score, which is used to evaluate the baseline risk of natural disasters or hazard in any one community. In addition to that, I put an example here on the right for what one of those scores looks like. This one particular one is for Norwalk, Connecticut. And then the bottom left, we have an example of what the Energy Star rating looked like, which is an assessment of 1 to 100 of the building's energy efficiency as compared with similar buildings nationwide. Every property was also eligible for an ASHRAE Level 2 energy audit, which really gave them in-depth knowledge about the existing energy efficiency of the structure, their building envelope, their HVAC, lighting, things like that they could do to improve the energy efficiency of the building. Almost all of our partners opted into this, with the exception of some new construction that we're already planning on being energy efficient. And it really gave them not only insight into how they can improve their energy efficiency and reduce their bills and improve comfort for their residents, but in many cases, it did influence the solar and battery storage assessment piece by stating, okay, we're interested in upgrading HVAC or doing X, Y, and Z to improve our energy efficiency, which therefore supports more resilient, longer lasting backup power. Next slide, please. So since improving health outcomes in the event of a power outage was our primary goal here, in seeing how resilience could do that, we wanted to come up with a health rubric that would allow for the solar and battery storage system to have considerations associated with the unique health needs of the individuals actually living in the affordable housing complex without violating any privacy concerns. So this health rubric, which we developed with American Microgrid Solutions, gives a nice umbrella insight into what considerations, working with the affordable housing provider, what considerations do we want to keep in mind when we're developing the system? Are there particular needs? What are your alternative arrangements? And if so, how long after a power outage are they put into play? And what are some attributes of your facility? And this really guided us into understanding, is a resilience hub an option? Are red plugs an option, which I'll get into a little bit later? You know, for instance, almost everyone we worked with had residents who relied on refrigeration for temperature regulated medication. And in that instance, can we have refrigeration for food and then separate refrigeration considerations in the event of an outage for folks to store their medication? And what would that look like? So this was a really helpful guiding principle of making sure that the design really was meant to meet a unique set of needs in the event of a power outage. Next slide, please. Next slide, please. Here we go. So lastly, I wanted to touch on actually what the techno-economic analysis focused on. So these next couple of slides dive into that. Nate is really going to overview what the results were and some of the findings, but oops. I think we lost our slide deck. Just give us 1 second here. Serena, I think we were at slide 22. Great, thanks. So this slide gives a kind of basic overview of what we focused on when we did this assessment. So we have the health rubric, we have the energy efficiency considerations into play. How are we going to actually analyze each one of these facilities for solar and battery storage? What kind of information do we want to get out of it? What scenarios do we want to play? What's most helpful for the provider? And what we came up with was, for this particular report, we assessed 15 buildings for the effort, and we pivoted for the report to put them into 3 buckets. So basically small, medium, and large based on their number of units, and kind of funneling that information into what are some averages that we're finding for the takeaway of designing solar and battery storage systems for these facilities. So every single provider in their assessment and in the analysis results represented in this report received 3 different resilient power scenarios. So basically 3 different systems were designed to support the needs of electricity-dependent residents in the event of a power outage, while also generating economic benefit for the provider, in some instances, an economic benefit for the residents. And those 3 scenarios were really based on different ways we could design solar and battery storage, and what are the resulting costs? What are the resulting incentives? I highlighted here on point 3, the economic implications. A lot of these scenarios you'll see really make sense in parts of the country that they would not otherwise, because of Connecticut Energy Storage Solutions, Connecticut's residential renewable energy solutions program. And we incorporated various scenarios with both a 30% baseline and 50% federal investment tax credit. So those were kind of the focus, looking at different resilient power scenarios and looking at them under different economic considerations to figure out what's the payback, what are the costs, and how much backup power can we actually give to folks in the event of an outage. Next slide, please. So the 3 different resilient power scenarios that we came up with were resilient power 1, which was solar and storage to support a resilience hub, which is basically a community space that exists within the affordable housing complex, so that while the rest of the facility wouldn't have power in the event of an outage, residents could access this community space that they already know existed, maybe they've used for other purposes before, for basic services like charging electricity-dependent medical equipment, accessing refrigeration, lighting, communications, community, things like that. Resilient Power 2 pivoted, and instead of looking at a resilience hub model, it looked at solar and battery storage to actually support an individual outlet in each unit of the complex. We call this here the red plug model. The photo to the right is an image of red plugs at a hospital, which is where this was adopted from, where in the event of an outage, reliable backup power is active to these outlets, these red outlets, in the event of a power outage, and folks know that these are the ones that they can use if grid electricity is not available. So we kind of co-opted that and applied it to a residential multifamily affordable housing scenario where everyone would have access to one outlet in the event of an outage in their apartment. Lastly, for Resilient Power 3, we combined them. So what would it look like to design solar and storage that gave folks the option of both a resilience hub and an in-unit red plug? So we're kind of like checking off both boxes there. Next slide, please. So with that, we will dive into actually what we found through the analysis, and I'll pass it over to Nate at American Microgrid Solutions.
Okay, thank you. And Zareen, maybe just go straight to the next slide. So Marielle's already explained that we talked about the three different cases, small, medium, and large, and within each case study, there's a RP1, 2, and 3 configuration, right? So let's talk RP1 first, resilience hubs. I'm assuming that most people are at least familiar with the concept of resilience hubs, a place where people in the community can go that they know is a safe space, somewhere they trust, somewhere that has the programming to support them both in normal times and during outages. And in this case, we're really talking about the power system for the resilience hub. So of course, we want to evaluate the costs versus the benefits of each of these configurations. And for the cost, we've calculated the cost for each of these systems based on our prior experience and our Rolodex of completed systems and how much each of those cost, depending on building type and 100 other things. The thing to know is that costs are not proportional to size. They're not proportional to the size of the battery. They're not proportional to the size of the building. They're not proportional to anything. And so if you were looking for thumb rules of how much does a battery cost for my building, that's a really difficult thing to provide because there are so many differences that are important to the cost of a specific installation. So the costs that we've calculated here are specific for the actual building represented by each of the three cases. And we can draw some general conclusions from that, but not necessarily thumb rules for your building, which may be different. We have assumed that the battery will be installed outside for all of these cases. In AMS's history, we've got one battery inside and one more on the way, so well less than 1% of the projects that we've done. And that's for a variety of reasons, but it is just much easier to put a battery, especially one of this size, outside as compared to inside. And the last piece on the cost front is that the total CapEx that you see in the report is a combination of the solar and the battery CapEx. And it's important to realize that solar is basically independent in these scenarios. Because we're doing multifamily affordable housing, because we're in RRES, that means we are doing the buy-all part of RRES. And in buy-all, the solar is connected outside of the normally metered building loads. So the battery is operating independently of the solar when it comes to managing, demand charges or time of use and that sort of thing. All of the solar revenues are fixed based on the size of the solar system and the rate applicable under that buy-all. So those two things work independently when we're on grid. All right, so when we have a resilience app set up, the question is how much electricity is it going to use, right? We estimate that based on the building type. Often we have actual bills from how much the building as a whole used, but we also need the physical and electrical layout of the building because the resilience hub will not normally be the entire building. It'll normally be a part of the building, and we need to know how much of the building that is and what electrical loads are available or supported by that area. So how much HVAC is there, what proportion of the receptacles in the building are there, and you can estimate that based on floor area. So from those things, we can get a baseline load profile for what the resilience hub is going to use, and then we adjust it based on the things we learned from the health rubric. So if we need to include the elevator, then the elevator gets included and that changes the load profile. If we need to include in-unit HVAC, that's a much different load profile than just a little bit of central HVAC for the resilience hub common areas. And therefore, that will change the resilience results. So the health rubric is important for informing what the load profile looks like based on the needs of the residents. When we do a resilient hub, the usage there definitely has some uncertainty, right? You don't know exactly how people are going to use it. It could depend on how long the outage is. Behavior could change over time because people could become more dependent on the resilience hub, or people could leave and then the resilience hub gets less use. So there's some uncertainty for sure in how much electricity is consumed in a resilience hub during an outage, but it's more or less controllable, right? If everything is being used in one space, then you can ask people to unplug certain things, or you can adjust the HVAC setting. Like whoever's operating the resilience hub has some control over that. And that's an important distinction to the red plugs, which we'll talk about in a second. And the red plugs are important because for a resilience hub, everybody's gathering in a central space. There could be plenty of reasons why people don't want to gather in a central space. They may have mobility issues where they can't get down to the central space and back up easily. They may just not like their neighbors. They may not want to be in a small space where you have concerns about illnesses spreading. So there's lots of reasons why people might want to stay in their rooms in a space that they control. And that's what brings us to red plugs. So if you can go to the next slide. For red plugs, we're assuming that we've got one outlet. Zareen, I'm not seeing the next slide. Can you move on? There you go, thanks. We're assuming that you got one regular outlet to provide power to the apartment. The installation cost of that, widely variable based on the type of building that you're in, the method of construction for whenever it was built, how the circuits are arranged in the first place. For this analysis, we've estimated it at a flat cost per unit. So if you have 100 units, it costs a certain amount per unit to go install those red plugs, and that includes the labor and the wire and the means of disconnection. The means of disconnection is important because for all of these analyses, we're assuming that the red plugs are not active during normal grid operations. In many buildings that are multifamily affordable housing, they're individually metered. And if they're individually metered, the residents are supposed to be paying for their own electricity. So you would undermine that by putting an active outlet in their apartment because everybody would figure that out immediately. So we're assuming that the plugs are off when the grid is up. And that makes a difference in the economic analysis because there is more load in the resilient analysis than there is in the economic analysis. So when we run the numbers for how much utility savings are, that's based on normal building or resilience hub load. When we run the numbers for resilience forecasting, that includes the additional load from red plugs if red plugs are part of the scenario. Installing these red plugs definitely has some issues, right? If you're imagining going into a building with 100 or more units and trying to put one new circuit into each of the apartments, you've got to get the wire there, first of all. If you're multiple floors, you've got to get the wire to the ones that are in the middle floors that are hard to access from the outside. You might have aesthetic concerns because you don't want to run conduit on the outside of the building. There are lots of things that could get in the way of installing these. And one alternative, if they are available, is outlets in the hallways. Those outlets are not normally used by anything. And if you can't route power to the individual units, then you could encourage residents to go plug things into the hallway outlets as a potentially less expensive option. But this analysis assumes that we've got a new plug in every apartment. And that plug, we estimate to use an average of 200 watts in each unit. Now, 200 watts is a relatively low number, but this is 200 watts per unit continuously throughout the day. We know that that's not how people will actually use energy, and there will be some variability in that, but that's very hard to predict because it's dependent on single individual devices and when people are awake, et cetera. But 200 watts over the course of the day is enough to charge your cell phone, keep your Wi-Fi on. It's enough to run your CPAP at night and to run your oxygen concentrator during the day and maybe a couple of other things. And so that's the estimate that we used for this analysis. If it was higher, then of course the red plug impact would be larger, but we think this gets us in the ballpark of what will actually be used by red plugs. However, very hard to control what those red plugs are actually using. If you put a full-size circuit with 15 amps into each apartment, then they could potentially plug in a power strip and start their microwave and run their vacuum as well, which is way more than 200 watts. So there are complications with how you control the amount of power that is available to each unit and how you recover if that amount of power is exceeded. Those all have solutions and all of them have their ups and downs, but that is one thing to consider when installing red plugs. All right, next slide. Marriele talked about how we did the 3 different cases, and we needed some way to make it so that we were comparing apples to apples as much as possible. And because this is a resilience-focused analysis, we focused on the minimum level of resilience you might expect from that system. And when we talk about resilience, the idea that I want to leave you with is that it is not a number, because when you're dealing with solar and storage, what matters is the relative amount of load versus solar, and that varies over the course of the year. That varies over the course of a single day. So some outages that happen, think of like right at sunset, those batteries are not going to last as long as an outage that started right at sunrise because you don't have the solar input. So time of day and time of year matter a lot. We talk about resilience with 2 numbers, and that is the typical resilience. So if we had an outage at any time during the month, what's the median result of how long you would last? That's what's depicted in the green line on the graph to the right. But there's a minimum, right? There is a worst case combination of load and timing and solar, and that shows you what your worst case forecast outcome for the year is. So what we've done in this analysis is we've matched up all the worst case outcomes across the 3 scenarios, resilient power 1, 2, and 3. And that's our basis for more or less equalizing the performance of these systems. You just know that the typicals are not the same because we've changed the ratio of how much load there is to how much solar. All right, so that's the resilience baseline. Next up. Next slide. Thanks. Okay, so on this slide, now we're talking about economics, right? So we've established our resilience baseline, and now we have to figure out, all right, how do these systems compare to each other and why? And what are the things that really drive, like, when is a system going to make sense economically? The diagram on the right has no numbers on it. It's just a conceptual diagram, but it still illustrates a point, right? And the point is that there's an interaction between the economies of scale that you would expect to see in a battery installation and the revenues that you would expect to see from programs like Connecticut ESS and others. So if we look at this blue line on the top, what we know is that when you go to install a battery, a commercial battery of this size, there's a bunch of overhead costs, right? You've got to pour the pad, you've got to dig the trench, you've got to do the interconnection, there's wiring on the inside, all that stuff, that infrastructure stuff has to be done before you get any resilience out of it. And once you do that, now it's just a matter of adding more modules, right? Adding more batteries, sometimes into the same cabinet, which is a pretty inexpensive thing to do. So the blue line starts high at a very high cost per kilowatt hour, but each kilowatt hour that you add costs a little bit less than the one before. And so you've got these economies of scale where as you build larger and larger batteries, the average cost per kilowatt hour goes down and down and down. Meanwhile, on the light colored line, you can see that the revenues from incentive structures like Connecticut ESS are basically linear. They're proportional to the size of the battery. So as you grow battery size to the right, the revenues from that incentive program go up. And at some point, conceptually, again, you cross over, right? And now you've achieved a point where the economies of scale are such that the incentives and all the other revenues available to the project, they pay for the battery. And then you're in the green section, right? Then you are in the money because the battery makes sense on its face. So that's the concept. There are some limits. So Zarina, if you could hit the first animation, there are some limits on the right-hand side. You can't go beyond a certain large battery size because all kinds of other things start happening, right? You might run out of room. If you want to put in a 2 megawatt hour battery, then you need to have room for a 20 or 40 foot container, and you might not have room for that on site. Also, if you want to collect the entire amount of revenue that's available from the incentive program, you need to be able to supply a certain amount of power. And at very large battery sizes, you may not have enough room in your existing electrical service to supply that much power. You just can't push that much back to the grid. And that limits your battery size as well. So there are limits on how big you can go, and bigger is not always appropriate, even if it would be economically better. Hit the next animation. Of course, you could also have budget limits, right? And so you start to wall off part of the decision space here. And the trick is to find the combination of size and revenues and constraints that makes a project work economically. So let's stick with this graphic. We'll go to the next slide and we'll talk about one of the cases in particular. And that's case study 3. This is the large affordable housing. So in the report and on this slide, you can see that the results are kind of what you'd expect given what I said so far, right? Because at low battery sizes, you haven't quite achieved the economies of scale. So if we look at RP2 in the middle, and I'll start drawing on the screen here. If we look at RP2 in the middle, then we see that the cash flow is $515,000 over 20 years. Right? And that when it says without ITC adders, that's baseline 30% ITC. And the largest of the batteries has the highest 20-year cash flow and the fastest payback, right? And that is what we'd expect based on these economies of scale that I talked about. So we haven't maxed out our economies of scale, but we have achieved our resilience targets with these scenarios. And the dashed lines that I put over here on the right are to indicate like where do these fall? Because we're talking about total battery costs in this conceptual diagram. And let's just expand that notion, right? It's not just installation costs, it's all the costs, right? It's the cost of installation, it's the cost of OpEx, it's the cost of replacement parts, it's the impact of parasitic load, it's the impact of declining impact of larger battery sizes on managing things like demand charges. So if you put all those things together, even Resilient Power 3, that has a positive $640,000 cash flow overall for the system, it doesn't quite make it, right? It doesn't quite make it into the green where we know that the battery is paying for itself. And this is, even though the Connecticut ESS program is one of the best in the country for this type of project by quite a margin, actually. And it ends up paying for 70-something% of the red plug plus resilience hub cost. And then you get the ITC on top of that. We'll see on the next slide, like you don't quite get there with just the battery input. And the difference between this RP3 not quite being in the green and the $640,000 positive cash flow is solar. Solar is not included in this concept with the lines that I've drawn. And solar is the thing that often pays for any shortfall in battery specific revenues. So the combination of solar and a very well compensated battery for RP3 at this facility means that the project overall is a very good project and it pencils on its own. Right. So I'm sure there will be questions on that idea and that whole discussion, so I'll leave those for the Q&A. But there are really two ideas on this slide. One is the economies of scale that you would expect to see and their interaction with the available revenues are visible in these configurations. And you still need solar to make the whole thing work together and have an economic project. All right. So we'll go to the next slide and we can just talk about the 3 different cases. So in these lines and in the table on the left, what we've got is Resilient Power 3. So that's Resilience Hub plus red plugs for all 3 cases. And I wanted to draw out what some of the differences were between case 3 that we've been talking about so far and the other 2 cases to give you a sense of like what matters and what doesn't when you're looking at a specific building. All of the percentages in here are expressed as a percentage of the CapEx associated with the battery and the red plug installation. So how much of that does it pay off? That's what we're getting at here. So in case 3, I'll focus on that first. That's the one we just started on. Connecticut ESS program is paying for 2/3 of the battery. Utility savings over 20 years, if you added up all the utility savings we expect, including the escalation we expect to see from utility rates, et cetera, all that adds up to 46% of the installation cost for the battery and the red plugs. And OpEx almost exactly cancels that out. So what that's telling you is that once the battery is paid for, the OpEx, which includes all of your replacement costs and all of the ongoing sort of software and operator cost, that is paid for by utility savings. And then the thing that puts you way over the top is the amount of solar offset that you have. So if you added up all the solar revenues from RRES by all for this 130 kW solar system, that's another 86% of the starting CapEx. So that's why you have a very large total down at the bottom where everything ends up paying for itself. All right, let me erase those. Now, if we go to case 2, that was the medium-sized building. Case 2, still a pretty good cost per kilowatt hour because we're in the large-ish battery ranges, like something more than 150 kilowatt hours. And so the Connecticut ESS program pays for still almost 2/3 of the battery. Utility offset is significantly lower because there's no longer a demand charge to be managed. Now we're talking about time of use and not that much electricity that we're trying to shift between the two. So it's not worth as much as the demand savings in case 3 were. OpEx turns out to be about the same, and the solar offset is still very reasonable. So that's why this project, depending on which ITC you pick, can pencil on its own. The one that doesn't pencil is case 1. And case 1, in almost all the categories, does worse than case 2 and case 3. So back to economies of scale. The cost per kilowatt hour to install the case 1 battery, because it's so small, is quite high. And that means that even though the Connecticut ESS program is doing the same thing per kilowatt hour, it offsets a smaller fraction of that initial CapEx cost. The utility offset is a little bit of a site-specific thing. Like there are no demand charges to manage. There's really no time of use either. But additionally, this site wanted to electrify as part of its overall efficiency program. So when it went from gas boilers to electric heat, that really increased the utility costs. And so that's reflected here. OpEx, again, turns out to be the same. A thumb rule we do have is about 2% per year of CapEx. Gets you pretty close to the ballpark of how much you would expect for operating expenses on a solar plus storage project. And then on this site, only 14 kW of solar, which means economies of scale again, the cost per kilowatt of installed solar is higher, which means that the buy-all doesn't quite pay for the solar system. It almost does, but it actually makes the project a little bit worse. So overall, there's it's pretty far from paying for itself overall. So those are the things that are different between the 3 cases. And it's important to draw those out. The big deals are economies of scale in size of battery and how much you can get from the utility and how much you can get from solar. Those are the 3 things that really matter. All right. So that is the end of mine. Happy to take questions when we get to the Q&A, but I will turn it back over.
Thanks, Nate. I'll jump in here. I'm Emily Basham. I work with Bryan Garcia and Ed Cranich at the Connecticut Green Bank. We provide financing and project development. And so I'll chat a bit about our financing product and the modeling that we did for the case study 3, or the large facility that Nate was just chatting about. So I'm an associate director of our Solar Marketplace Assistance Program, or as we affectionately call Solar MAP. Many affordable housing providers are capacity and resource constrained, and so they're looking for support or financing to adopt these technologies. Through Green Bank's Solar MAP program, we work with municipalities, state agencies, and of course, affordable multifamily housing providers in Connecticut. And we provide turnkey project development support and financing. So this includes no-cost technical assistance to do the project feasibility, and then the Green Bank oversees all of the project development, running a competitive solicitation to select an installer, and then we manage all of the development, design, permitting, procurement, installation. So as I mentioned, many of these properties are debt constrained. They're not able to provide the CapEx layout that's required for a solar and storage project, as Nate was running through those economics, or they need to see a financial benefit prior to that payback period. So in many instances, properties are looking for a financing option. In Solar Map, we offer a solar lease, as you'll see kind of depicted on the graphic here on the screen. This isn't a lease typically thought of like for a monthly equipment rental, but rather you can think about it as a revenue share mechanism where all of the project revenues are split between the tenants of a property, the property owner, and the system owner, or the green bank is the system owner. And we're providing a financial benefit to all three through the lease mechanism. So as the system owner, the green bank is monetizing all of the federal tax credits and all of the incentive benefits, the ESS program that we touched on earlier with Ed's presentation, and the state solar incentive available in Connecticut called the Residential Renewable Energy Solutions Program, or RRES, offers a solar tariff for the solar benefits. And so through our lease, we're monetizing all of these revenue streams. Green Bank is fronting the capital to complete the installation, so the property owner does not pay any upfront capital costs. Green Bank is receiving a portion of those project revenues to recoup our investment, and the tenants receive 20% of those project revenues as a requirement of the state incentive program rules. And then the property owner is receiving the remaining project revenues. The property owner receives those, their portion through an on-bill credit on their electric bills. And then the tenants would receive their credit either as an on-bill credit on their electric bills if they are individually metered, or if the property is master metered, the benefit is used to install a building upgrade such as battery storage, or implement a tenant serving program. So all in all, over the 20-year term of the lease, the Green Bank owns the system. So we're responsible for doing all of the maintenance and bearing the development risk. This structure has been a really great fit for the affordable multifamily properties that the Green Bank has been working with over the last year. And through this partnership, we've been modeling projects that come through the program for lease modeling as well. So we will do a spotlight on case study 3 for how our lease modeling looks there. If we can go to the next slide. So once an assessment is done, the property has the option to look at lease option through the Green Bank Solar Marketplace Assistance Program. Here we provided solar lease modeling for a solar and storage system. The system size here is the 130 kilowatts solar system. We modeled a smaller and larger battery option for this property. Today we're focusing on the economics for the smaller battery option as it corresponds to the RP1 scenario in the report. So here we've got a 125 kilowatt, 330 kilowatt hour battery. Under our lease structure, the property owner's share of the project revenue is about $5,000 per year and provides approximately $90,853 over the 20-year lease term. The tenant share of the project revenue is $171,000. In this property, the facility is master metered, so the tenant benefit isn't going as an on-bill credit, but rather it's going towards an upfront upgrade to the building. So in this case, the tenant portion is being reinvested into the cost of the battery, bringing that cost down. So that $171,000 goes towards the battery cost, and then $90,000 goes towards the property owner, and the remaining project revenues come to the Green Bank to recoup our investment. A couple notes here. The scenario that we're looking at is based on the base 30% ITC scenario, so it doesn't include any of the ITC adders. And we are also modeling just a 10-year useful life for the battery and a 20-year useful life for the solar. So overall, you can see through this lease structure where Green Bank is stacking the ESS and solar incentives with the tax credit. We are able to fully finance the cost of the project without requiring any investment from the property owner. And these economics allow the property to adopt these technologies and have a positive cash flow right starting in year one, as well as providing the property with resiliency. So it's a great option to look into. And with that, I'll turn it back to the group to take us to the next part.
Great. I'm just gonna, wrap this all up here with some of the key takeaways that we found by putting through this effort and by putting this analysis together. I highlighted the results from the analysis indicate that supportive policies and programs can both result in improved project economics for solar and storage, and also encourage more robust systems and energy resilient solutions for medically vulnerable populations. That's kind of the underlying theme here, and we can dive into some additional takeaways in the next slide. So big takeaway here is that incentives that value resilience, as the Energy Storage Solutions Program does, can support improved health outcomes in the event of an outage by providing more robust energy resilient solutions. Nate talked through a little bit of the large facility, but really having solar and battery storage be able to power more loads, whether that means the smallest size battery through the resilience hub model to the medium sized battery in the red plugs, or the largest, the resilience hub in the red plugs. All of these scenarios help folks in the event of an outage be able to shelter in place or safely wait for medical support in the event of an outage. And having incentives available that actually make these projects economic allow affordable housing providers who are already working to improve the quality of life for their residents and invested in their well-being be able to take the step towards energy resilience beyond whatever existing backup power they may have or not have. Next slide, please. So another piece here is that comprehensive incentive programs include technical assistance. So initial partnership with Clean Energy Group and Connecticut Green Bank was to dive into how can we provide awareness building and technical assistance to multifamily affordable housing providers so that, one, they know the Energy Storage Solutions Program exists and the economic benefit it could have for a solar and battery storage project at their facility, and two, to guide them through this process. So Connecticut Green Bank, Clean Energy Group, and American Microgrid Solutions really worked in partnership here to build awareness about solar and storage technologies, work individually with all 15 projects and affordable housing providers to ensure they understood what solar and battery storage was, they understood the process, they got to develop their projects hands-on and really ask questions throughout. They wouldn't have been able, without this technical assistance, the feasibility assessment and the hand-holding, none of the projects that we had worked with would otherwise had been able to explore battery storage. So this is a big capacity building component, and it's really necessary, and not only ensuring that people know that a program exists, but that they can access it and understand how to go through it without necessarily paying up front for the assessment, since those were all no cost. Next slide, please. So Nate touched on this perfectly. I'll just mention it again. In our analysis, larger facilities benefited from economies of scale for battery storage. Smaller facilities encountered more challenges. So Nate mentioned for case study 1, which was the small facility, we estimated that range to be 6 to 20 units. What we really found was that there were a lot more complexities to the project in addition to them just having a smaller battery. So a lot of the smaller facilities that we worked with were trying to do other upgrades, like going all electric in this case, or they had other considerations that they were trying to think of to be able to fit the solar and storage in their building or on their footprint. So there are utility rate complications for how they can actually generate savings through solar and storage. These were not unique to just the facilities that we assessed. There are oftentimes just the challenges that smaller facilities have in wanting to improve the facility and be able to provide backup solar and battery storage, either solar and or battery storage. So it's not to say that it's possible, it's not, but for our small case study only, we did not have any, none of the solar and battery storage scenarios penciled out, although solar alone did in some instances. And it's just a takeaway that these facilities, smaller facilities, might need a little bit more support and more tailored programming to ensure that they can cross the finish line. But our medium facility, which was 21 to 75 units, and the large facility of over 75 units, did either in every instance or in most instances pencil out. And that's where we start to see the economies of scale and everything that Nate had said. Next slide, please. In-unit resilience can be a cost-effective option for multifamily affordable housing providers and the preferred resilience solution for residents. So as Annie had mentioned, some residents just prefer to have backup power in unit, which is understandable, right? They don't want to expose themselves to illness, or they're uncomfortable accessing a community space. And while this typically means that it does mean you're going to have less available to you, maybe a plug in and of itself is enough to get through a half an hour outage, an hour outage. And this could be very well, especially in Connecticut, where we're seeing the average power outage, it could be a really great solution for a shorter period of time, or just to get folks, keep them safe until emergency help can arrive. I think this is a particularly interesting takeaway because Clean Energy Group provides technical assistance to affordable housing providers across the United States. And we have, at least in my experience of the 50 to 100 odd affordable housing projects we've supported with technical assistance, have not seen a red plug model pencil out, much less a red plug paired with a resilience hub model pencil out economically. So being able to talk to affordable housing providers and let them know that actual in-unit resilience or in-unit resilience paired with battery storage can not only be available to their residents, but economically beneficial to them and their residents is a huge takeaway for the value of really incentivizing resilience. Next slide, please. Yep, so those were some high-level takeaways. We have about 15 minutes left for questions. I'd encourage anyone to write theirs in. If we don't get to yours, we will, you're always welcome to follow up with me, and I can make sure to get you to whoever can answer that for you. So with that, I'll ask everyone to hop back on video, and I'll pass it to Anna.
Awesome. Thank you so much, Mari. Thank you so much to all of our panelists today for sharing your wisdom and all the information that you all had shared in the report and summarizing it in today's webinar. The first question I have is going back up to the beginning of today's webinar, and it's for Annie and Keyla, and it's for the work that you all did with the residents and looking at the residential needs for resilient power. Do you all have any advice? Do you both have any advice for affordable housing providers that are considering red plugs or resilience hub model? Well, first off, if they're considering it and they want to do some sort of resident feedback cycle to see what their residents prefer, do you have any advice for them on how to go about that for their facility?
You want to jump in, Keyla?
Yeah, I just want to make sure I understood the question. They're looking for assistance with kind of figuring out how to gather this information of what they prefer.
Yeah, how to assess their residents' needs.
Yeah, so I found the residents to be very open and inclined to answer any questions that we had. I think they really appreciate the idea of this level of project even taking place. Something as simple as maybe a focus group, or maybe if it's an individual interview, I think would be an ideal setup, especially in the community that they are in. It's very easy for them to get to. It's ideal to not have them step away from where they are.
Yeah, I'll just add to that. We did find, and we were originally going to do primarily focus groups. And while that worked in some ways, we did feel like we weren't hearing the real kind of detail that we needed to hear. So we kind of pivoted to doing more individual interviews, both because some people didn't want to share in a group format, but also because some people's situations were so complex that the focus group wasn't the right format for that. So I would suggest a combination. And then the other thing I'll add is that I think everyone we spoke, well, when we spoke to people in buildings where they felt that the management was responsive to them, they felt like the interview and the focus group was actually useful and was going to lead to something. We sort of got the impression, I think, in buildings where the management was less responsive, it felt a little bit like, you know, we don't get taken care of here. So I think just good communication all around will mean that the feedback you get will be more productive.
Great, thank you. This next question is for Nate. So when looking at affordable housing providers, specifically in the red plug model, was there a typical energy watt hour per red plug that was assigned per unit? So the question was, what is a typical battery provided energy watt hour per red plug during an extended power outage with low PV production?
Sure. There was not a number of kilowatt hours added to the battery size explicitly, if that's what the question is asking. So it's not like if you say, you know, I have 10 units and they each draw roughly 5 kilowatt hours per day, then I need to go add 50 kilowatt hours to the battery. That's not necessarily the case, because while we do estimate that they're going to use an average of 200 watts all the time, and that is 5 kilowatt hours a day, that doesn't necessarily mean that you need that much more battery, because the solar could be offsetting some of that. So we base it on the resilience metrics, and we drive the battery from the worst case performance.
Great, and I may be sticking with you for this next question. Someone was curious about, does private health insurance or Medicaid help to cover in-home battery backup? And I can start by answering that because for this analysis, we were looking at a whole building backup. The economic analysis did not include, you know, how a private individual's insurance could impact cost. And I don't know if anybody on the call happens to know if for residential buildings, for an individual, if insurance would cover the cost of a battery.
Oh, go ahead, Bryan.
Oh, no, please, Mario, I'll follow you.
I was just going to note that in our research, Clean Energy Group has been working on health and energy security for a while, especially for the electricity dependent residents of either individual single family homes or multifamily affordable housing. We have found very few cases of health insurance or Medicaid providing support for backup power systems that are located in your home, right? So there are instances where certain electricity dependent medical equipment maybe has an external battery you can get for that piece of equipment. It's not true for all equipment, but it is for some. That varies a lot because there's so much medical equipment out there. But there are very few cases where they'll say, forget about solar and storage, much less even like, here's a diesel generator, right? That could be able to support your electricity dependent medical devices in the event of a power outage. And I think that points to the fact that while we are encouraging people as like a society and through health insurance and different policies that to age in place, which definitely has physical health, emotional benefits, the insurance has not caught up to that. So when you see places like nursing homes and other assisted living facilities that are mandated in some states to have reliable backup power in the event of an outage, because we've seen deaths during times of extreme heat and extreme cold, that's not applying elsewhere. And I think part of this effort was to see how can we link the needs of electricity dependent folks that still live independently to showcase that this type of support can really improve health outcomes in the event of an outage, reduce the capacity constraint on public health, and kind of lift all ships. I can pass it to Bryan.
Great. No, just following up. It's a great question. The Robert Wood Johnson Foundation's theory of change here is really that the healthcare industry and the insurance industry are potential co-investors in community assets through Medicaid. So you're getting towards something that is market transforming. I don't think we're there yet. I mean, just as the Green Bank, for example, partners with the banking industry to mobilize private investment in clean energy projects, you know, around the country. The Robert Wood Johnson Foundation sees the healthcare industry and the insurance industry as being co-investors in community assets of projects of this nature. So that is something that they want to see happen. The techno-economic analysis that Nate went through spoke specifically to all the energy incentives, the RRES, the ESS, the federal investment tax credits, and all of those energy cash flows. But you can envision at some point, if there is research that demonstrates a public health benefit from doing this sort of work, where there could be incentives coming from the public health industry to encourage these types of investments to build those into the cash flows as well. We're not there yet, but I think that is the aspiration, is to try to bring other industries and private capital into the clean energy, climate change resilient space with a public health and insurance flavor to it. Great question.
Speaking of the economics of a project, someone was curious, and I think this question is for Nate first and foremost, is would it be more cost effective, or would it ever be more cost effective to provide cooler size batteries on wheels to select residents versus a red plug approach? So essentially some kind of mobile battery unit that folks could check out during the event of a power outage versus the red plug design that was studied?
Sure. Maybe, right? And so it kind of depends on what it's paired with. The real benefit to doing it as a system is that you can have solar replenish the batteries, and you wouldn't want to give that aspect up, right? Because that's what, in some cases, gets you to very long endurance. So if you have an outage during the summer, you might go 3-4 days and be able to support the resilience hub and the red plugs with the system that we've designed. If you made the battery smaller and had mobile batteries that you just went and plugged in and then took back, you definitely sacrifice quite a bit of economy of scale, and you force the residents to go get it and bring it back, and batteries are heavy, and then they'd have to bring it back down when they were done. And of course, they'd bring them back at night, right? And so that they wouldn't be charged when people need it. So that it adds, I think, logistical complications as well as an economic penalty. And of course, someone has to keep track of those, right? Like someone has to actually manage it. There's a lot of benefit to having a building that operates automatically, because when you have some kind of an outage, especially if it's a regional disaster, there's a good chance that whoever is supposed to go there and do something in person may not be able to get there, or they may be otherwise occupied. So there's a lot of benefit to having things happen like they're supposed to automatically for as long as they can.
Thanks, Nate.
If I could just add to that, I wanted to highlight a case study where they did find success with that, and in New Orleans, where they've had a lot of work led by Together New Orleans to lead like a community lighthouse initiative and resilience initiative locally. Footprint Project, who leads a lot of trailer-based solar and storage systems, so large mobile solar and storage systems that can be used in the field during disaster response especially, but can also be plugged into some buildings. They had a pilot where they had a large battery storage model on a trailer that basically housed a locker for individual cell phone chargers. And they saw a lot of success from the community coming out, basically renting out for free, no cost, these cell phone chargers, using them, and then all of them, I think all of them except for one or two, got returned to recharge. And they would recharge back at this centralized solar and storage trailer that was also, the Red Cross was there using the battery for their laptops. And in that case, having like a mobile solar and storage system that charged smaller batteries really worked out great for the community. It worked out great for emergency response, but a solar phone charger is much less capacity than if you were in smaller and, more easily to go out and grab and bring home than say if you needed a battery to power medical equipment for a long period of time. So I think it really points to that resilience and solar and storage applications are different depending on the need, and there's a lot of innovation in different ways that you can do things. But if we can site something in someone's home and generate the, we didn't get to touch on because this is only so long of a webinar, but the economic benefits provided through the RS program in Connecticut for residents is massive, whether it goes back to the resident's utility bill or it's reinvested through battery storage. The economic benefits of battery storage for providers to be able to put money back into community programs. I mean, that's why we like to look at the values of resilience as a holistic. So you don't have to pick one. You don't have to pick just economics. You can pick economics, health, reduced emissions, things like that.
Thanks, Mari, for that addition. Yes, the Connecticut programs, incentive programs are very in-depth and the best, one of the best in the country is for sure. One of the commenters here had a question about the Energy Storage Solutions program and wanted to clarify whether there was any increased incentives if storage is paired with PV. So I'm hoping Ed or Emily would want to clarify the difference between ESS and maybe comparing it to the RRES program.
So in energy storage solutions, we have no requirement that the battery is paired with PV. So the incentives are the same either way. And having a battery does not affect your RRES or NRES credits at all because we measure at the inverter level of the battery. And essentially all you're doing is time shifting when power is being sent back to the grid. So it shouldn't affect your RRES or NRES credits at all.
Potentially one more question related to the financials of a project as we're coming up on time. Someone's asking if we analyzed how energy efficiency measures impact the benefit cost analysis of multifamily solar and storage. That might be a good question for Mari or Nate to speak to the ASHRAE level 2 analysis.
Sure, that's the easiest one. Always do efficiency first. Always. Don't do anything before you do efficiency. If you have a chance to make it more efficient, everything gets easier, right? And so this discussion of economies of scale is that yes, batteries are more economical as they get larger. That doesn't mean that you should leave your electricity usage overly inflated in order to get a large battery, right? That doesn't work at all. That negates the whole thing. So for sure, do the energy efficiency stuff first. For case 3, the results there do include the projected impact of some of the energy efficiency measures that we revealed in the phase 2 audit, or the level 2 audit. So yes, absolutely, always efficiency first.
Awesome,
I think
thanks,
that's
Nate.
a good way to point to the fact that for case study 1 for the small building, they used their opportunity to convert to an all-electric system, which would be able to be supported by solar and storage and provide HVAC to their entire building in the event of an outage. So they were prioritizing electricization and being able to provide an increased level of resilience to the residents, but that also equated to having by far the worst economics of all the projects. And like I said before, that's not unique to this small facility. It's a consideration for many. So you know, it's always, these are holistic projects where there's multiple value streams and they can all be considered.
Awesome, thank you both. I will slide in one more question, and this one's for Annie and Keyla, back to you both. Someone's asking or saying that some in-home medical devices have their own custom backup batteries, and they were wondering first if in your conversations with residents, if folks had spoken to their own electricity-dependent medical devices and if they had backup power and what their experiences with that limited amount of backup power were.
Based on the feedback that we received, specifically with the home medical devices, some did mention having to have a backup for it, a backup battery. But the biggest complaint was that the battery wasn't something that lasted for long periods of time. On average, we've seen some folks go without power for 3 to 7 days, and that wasn't something that, you know, was able to hold up for that time.
I just think complementing that, I definitely remember a couple of times when someone felt pretty relaxed about the whole thing because they did think that they had a good, maybe there'd been an experience before and that they felt that their battery had lasted. So I think in response to that question, helping people understand the length that their battery would keep them going is something that would definitely be helpful.
That's a good point, and it goes back to Nate's conversation about minimum and typical resilience when trying to plan for how big a battery should be to back up a affordable housing complex with the resilient power. So as we're just 1 minute away from the top of the hour, I will wrap things up. Zareen, could you bring up the webinar slide deck? Thank you all so much for joining today's webinar. As Zareen said at the top of the hour, we will be sharing a recording of today's webinar with you all within about 24 hours to the email that you all registered for today's webinar on. If you enjoyed today's webinar, we have many more coming up over the next month. The next one is on April 27th. 22nd rather, and it's on load growth and electric system reliability. You can go to our website, cleanegroup.org, to see all of our upcoming webinars and register for any that you may be interested in attending. Again, thank you all so much for attending, and thank you so much to our panelists for joining. I hope everyone has a wonderful rest of your day. Take care, everyone.
Thank you.